it wasn't so like this before. So today's session, we're going to dedicate as much time as possible to discussing whatever information I could compact in like a 45-minute session about omega-3 fatty acids. Okay, so what are omega-3 fatty acids? Well, we have different kinds of fat that comes in from our diet. One is the saturated kinds and the second is the unsaturated. So we are not going to look at the saturated fats in this session. What we're going to discuss is primarily these things called saturated fat, unsaturated fatty acids, where unsaturated fatty acids have double bonds in them. I think there are some people in this audience who are not practitioners, so I won't get too technical. I'll try and keep it as non-geeky as possible. But the three unsaturated fatty acids that we are going to focus on are the omega-3 fatty acids. They are called omega-3 because their double bond starts at the third place, the omega line. Okay, so unsaturated fatty acids have a hydroxyl group and they have the methyl group, which is the omega end. And in omega-3 fatty acids, the first double bond, right? The first unsaturated bond actually starts at the third place in this long chain. So that's why they're called omega-3 fatty acids. There are three types of omega-3 fatty acids. The first one is alpha linoleic acid, also known as ALA. The second one is called icosapent.
Okay, no worries. We'll catch up. I'm in a meeting. We'll catch up.
Making a very nice request that please mute yourselves. It's basic courtesy on a Zoom call. Yeah, thank you. Okay, going back to my slide. So there's the icosapentaenoic acid, which is the second kind of omega-3 fatty acid. And the third one is what is known as docosahexaenoic acid or DHA. So there's ALA, EPA and DHA, and all three play different roles in our body. The first one, ALA, it's the simplest form of omega-3. It's there in plant foods and in animal foods. So typically when people say flax seeds are a good source of omega-3s and pumpkin seeds, like, a lot of the vegan whole food plant-based practitioners talk of flax seeds as a source of omega-3. But the omega-3 coming from that is usually just ALA. It's alpha linoleic acid. And what we really require in our diet is all three, more of the EPA and DHA, less of the ALA. EPA actually is very, very potent in reducing inflammation. It's a slightly more complex omega-3. It's more complex than ALA. It has 5 double bonds and it comes primarily from fish oil. It also has, like, there is this evening primrose oil which does contain some amount of EPA, but primarily it comes from animal sources, especially seafood, fish oil and krill and those kind of sources. And the third kind of omega-3 fatty acid which receives a lot of attention is your DHA or docosahexaenoic acid. It improves nervous function. Again, it's a complex omega-3 with 6 double bonds and it only comes from animal sources. It is not present in plant sources at all. It is super important for brain function. Okay, so when we say nervous function, we are literally talking of the brain and the neurons and the nervous system, the spinal cord and all its communication with all the different nerves in your body. And see, we at iThrive, we keep researching a lot of different dietary protocols. What we found out is vegan protocols are often extremely deficient in DHA because it doesn't come, right? Plant sources don't have DHA, and DHA is a critical omega-3 fatty acid when it comes to brain function. And people need to supplement. So if you're not having fish and seafood in your diet regularly, EPA and DHA is something that we need to supplement externally. But these are the primary 3 omega fatty acids that come from dietary sources and are important for a lot of functions in the body. Okay. Okay. So when did omega-3 fatty acids really become mainstream? See, now we know that they're essential to normal health. Most of us know, like even if you look up on Amazon, there'll be so many products that are on sale for omega-3s. And it was like research in the 1930s itself that started bringing attention to the fact that there are some things that are coming from fat that really help our health. But true focus and true awareness of omega-3 fatty acids really increased from the 1990s. There were researchers who were studying this tribe, in the frozen Greenland parts. They were called the Greenland Inuit. So these tribes had no access to grains and vegetables because they were living on frozen glaciers, right? But their primary food was a lot of whale fat, whale blubber, seals. Sometimes they would hunt caribou, which is the species of like the deer kind of thing that's there in frozen lands. And they saw that these populations, the Inuit, had very low rates of cardiovascular disease, had very low issues with BP or even metabolic health. They really had super functional health internal. And that research began in 1970s, and over the 1990s, omega-3s actually started becoming pretty mainstream. In 2004, the US FDA actually gave the qualified health claim status to EPA and DHA from the perspective of coronary heart disease, which means all the research that had come, all the papers that had been kind of published by scientists, it was enough conclusive evidence to tell the FDA to say that, okay, actually EPA and DHA supplementation or EPA and DHA inclusion in our human diets really helps reduce the risk of heart disease. And it was a big boon for that, because then helping people understand that if their diet was not rich in EPA, DHA, they had to supplement became much easier. Okay, so, what we see in our work actually at iThrive, a lot of people's omega-3 status is very low, like they're very deficient in omega-3s. And it led us to question, like, why is it now that we're seeing so many people with omega-3 deficiencies, right? Like, and then everybody is like, oh, modern day diets and the way we are eating now, that is really the cause of it. And then we I think even Aditya is here. He's part of the team that developed the krill oil supplement. So we then started thinking about if the deficiencies are arising now, where did humans really meet these needs in the past? Right? Were humans always deficient in omega-3s? Were these issues with omega-3 deficiencies always there in humanity, or is it more of a modern day thing? And we realized that our ancestors actually met their omega-3 needs very naturally, right? So there's this book by Dr. Michael Crawford. We found out that a lot of our evolution in terms of our increased brain size, our brains becoming bigger, also correlates with the anthropology of humans migrating and living closer to water bodies where they were eating more fish. And there are a lot of studies, like I can't put all of these studies here, but there were a lot of studies that started proving this theory that omega-3s and the expansion of the human brain were deeply correlated, right? So the consumption of foods rich in omega-3, primarily seafood and fish, and human intelligence went hand in hand. And then he studied dolphins and all that. I put that on the slide, so you can read it from the slide. But the assumption is that even though zebras and dolphins are pretty similar in brain size, pretty similar in body size, dolphins have bigger brains because their diets are rich in omega-3. But we know this that anthropologically, as humans started moving more towards water bodies, their intelligence just skyrocketed, which also was demonstrated in behaviors like coming together as tribes, doing things together, which required collaborative efforts and participatory efforts. So our ancestors mostly got omega-3 from the water bodies that they were living close to and eating the fish and the seafood that was growing in that. Also, if I look at our grandparents and that generation, they ate a lot of real food, a lot of, like, even the eggs that they ate were not really industry created eggs, right? They were mostly pasture raised eggs. So omega-3 came from there as well. And then the question is, how did we mess up things now? Because that's what we really want to know, right? Like, if things were good before, why are more and more humans getting sicker? Why is the burden of chronic disease becoming bigger and bigger? Why is it that it's going to be $1 trillion burden on the economies of all the nations? Why is it that even with something like COVID, people who had higher inflammation were really showing bad, higher mortality rates? What was really creating that inflammation? How was it that our internal health was so messed up if things were better in the past? And see, there are a lot of things that have happened with human beings, right? Along with industrialization, we have moved away from a lot of whole food based diets. There is a lot of fear about mercury in seafood. So many people avoid eating seafood because of the mercury load. Also, like, there's this entire wave of veganism and whole food plant-based. There are many celebrities endorsing it. There are many plant-based alternatives to meat that are coming up. So we are generally moving away from what we were most of our ancestral diets. So we're moving away from real food. We're moving away from foods that are rich in omega-3s. And along with that, our seed oil consumption has increased, right? So when I say seed oil, these are oils that come from seeds like mustard and groundnut and sesame and sunflower, safflower. A lot of them are advertised as heart healthy oils because there are big corporations that make money out of us buying those oils. But these seed oils are very, very high in another kind of fatty acid called omega-6. Okay, so we'll look in the next few slides, we'll look at what omega-6 does versus what omega-3 does. But because our intake of omega-6 fatty acids have increased, whether we are cooking at home in these oils or whether we are ordering from Zomato, Swiggy, or whether we're doing like frozen foods and reheating them, these are very high in omega-6. So because of that, our need for omega-3 has increased. Plus, if a diet is high in refined sugar, if the vegetable oils are rancid, right, like stale vegetable oils, the protein is low, B6 is low, calcium, magnesium, like your diet has very low antioxidants, all of this increases the demand for essential fatty acids, because these choices and these decisions are all things that create inflammation in the body, and your body uses omega-3s to kind of fight inflammation. So the requirement itself starts going up. Alcohol consumption depletes omega-3s from the brain. Chronic health conditions, right? So one is you're getting sick because you don't have enough omega-3. Second is, now that you're sick, you're going to need more omega-3s to fight this infection, to fight the inflammation, right? So again, it becomes a vicious cycle. But if you have any kind of illness, any kind of chronic disease, your need for omega-3 fatty acids goes up. And then genetically, you might have issues where you need more omega-3s, right? So if you have genetic errors where your body's detox pathways are broken, or you have genetic anomalies where your body's ability to deal with oxidative stress is compromised, all of these states trigger higher and higher inflammation. And then because of that, your omega-3 needs start going up. So this is how it's become worse for us now as a generation. Okay, so what do omega-3s really do when it comes to inflammation? The image might not really give you the okay. So when your diet is very high in omega-6, so the immune system reacts differently depending on the amount of omega-3s in different cell membranes, right? So if you have a standard diet, whether American or Indian, if that is very high in omega-6, that reaction in your cell membrane is going to be very different than the reaction in your cell when there's a diet that's rich in omega-3 and gamma-linoic acid. When you have too much of omega-6 going in, your body starts creating these products. These are put up here more in detail. So you have leukotrienes, thromboxane, and prostaglandin in these forms. So LTB4, TXA2, and PGE. LTB4 actually promotes inflammation, it constricts airways, and the amount of LTB in your bloodstream actually increases the duration of the inflammatory response. So they're very pro-inflammatory, all of these byproducts of your omega-6 fatty acids from your cell. Your TXA2 actually constricts blood vessels, it constricts airways, it increases blood clotting, it reduces circulation. Okay, so it actually impacts the flow of blood. And so thromboxane is anything, it's something that actually creates thrombosis. It's something that induces clotting. Very, very big risk factor when it comes to heart issues, because we don't want blood clots happening in our body. The purpose of the blood clotting reaction in our body is always protective, of course. Like in case of an injury, if there's a cut or a wound, your body wants to prevent loss of blood. That's why there are so many factors that cause blood clotting. But when this happens internally within your cells, within your arteries, that's actually quite dangerous. And then you have the prostaglandin E2. So this increases sensitivity to pain, it increases swelling, it induces fever. Again, it constricts blood vessels. So if you can see, all three of these byproducts of the diet that's high in omega-6 actually are inducing inflammation, are creating risks like increased blood clotting, and most of them are constrictive in nature. So airways are getting constricted, blood vessels are getting constricted. It's not how your body is meant to really be when it's in a mode of thriving. We're supposed to be relaxed, we're supposed to be in a state of flow. On the other hand, when your diet is rich in essential fatty acids, the products that are produced, you have your LTB5. Okay, so it's a leukotriene 5 series. This relaxes the blood vessels, this increases circulation, this relaxes airways, and this promotes an anti-inflammatory response. So it's actually exactly opposite of what LTB4 does. Similarly, your prostaglandin E. Okay, so what PGE3 does is it improves circulation, very important. It decreases sensitivity to pain. It again relaxes blood vessels and it promotes an anti-inflammatory response. PGE1, prostaglandin E1, relaxes muscle spasms. Okay, so it relaxes your muscles. It reduces blood clotting, increases protective stomach secretion, and it improves circulation. So if you notice, all the actions of these byproducts are anti-inflammatory in nature. They are more supportive to your body's functioning. These are all pro-inflammatory, and an inflammatory response is important when your body is trying to protect you from something like a pathogen or a toxin or something like that. But it is, if it's there for a long duration, it's actually going to start damaging your body. Okay, so this is omega-6, omega-3 metabolic pathways. So let's say you have linoleic acid. I'm not going to go into the full biochemistry of these pathways, but you have these nutrients, your vitamin B6, your magnesium, your zinc, and then you have the enzymes that act. So these enzymes act both on omega-6s and omega-3s. But what you will see is typically a lot of the omega-6 pathways end up going into the arachidonic acid production, and these create these pro-inflammatory compounds, which we saw here, right? These pro-inflammatory compounds. And if you look at your omega-3 pathways, these are creating a lot of the anti-inflammatory compounds, the ones that we saw here, right? So this is biochemically how omega-6 and omega-3 pathways are different in the body. Here we looked at when a diet is high in omega-6, this is what is produced. When a diet is rich in omega-3, this is what is produced. Here is the actual biochemical explanation of how that's happening. And then this is, so there is another series of unsaturated fatty acids called omega-9s. We are not looking at those right now. But if you look at omega-6, entirely inflammatory responses, right? Versus omega-3s are creating a lot of, they're reducing the endothelial activation, which means your cellular integrity actually starts becoming better. Your cells actually start having smoother surfaces. Your Th1, T17, which is immune response, that starts coming down. And then your tissue starts going into a state of homeostasis, right? So it has a protective effect on the heart, liver, and brain. And there is increased resolution of inflammation, which means the uptake and clearance of apoptosis, which is like cells that are breaking down. So the clearance of those cells actually starts going up. So your inflammation itself starts going down. Now, this is happening at a biochemical level, right? It's very hard to sit and go into your biochemistry. I mean, it's good knowledge, but you want to really see this happening. We are outside our bodies. We are looking at the world outside. We don't have the ability to go inside and look at inside its cell and seeing what's happening in terms of the enzymes and the reactions. So how would you know that maybe your diet is not providing you with enough omega-3s, and maybe whatever you're experiencing as symptoms could be because of an omega-3 deficiency? See, a lot of symptoms that I've put down here, a lot of symptoms that we have also seen in our work can occur because of other issues also. So it's not that you'll just have weakness because of an omega-3 deficiency, or it's not that you'll have blurred vision just because of an omega-3 deficiency. There are many root causes to any symptom, but if you have an omega-3 deficiency, then these are some of the symptoms we'll see for sure, right? So numbness and tingling because your nerve cells start getting impacted. Weakness because energy production and cellular integrity itself gets impacted. Pain because if you look at a lot of the omega-6 byproducts, they are pro-inflammatory and they increase sensitivity to pain. Psychological disturbances because your DHA is required for your brain to function well. Now, if you are DHA deficient, it's going to impact your brain's neurowiring and its neurochemistry. And then that's going to impact your psyche because a lot of our mental frameworks and how we respond to the world outside and our behavior comes from how our brain is working. Poor cognitive function and difficulty learning. The brain is that hardware on which learning and all those functions are based on. Poor visual acuity means that like your actual vision itself gets impacted. Blurred vision is where you're not able to see clearly. Poor immunity. If you have an inflammatory response in your body for too long, your ability to deal with external stressors like a virus or a bacteria is going to get impacted. So immunity can come down. Poor growth, inflammation, we saw that pathway, joint pain and stiffness, skin irritation and dryness. So these are the problems that we've seen that are associated with omega-3 deficiency. There are a lot of research papers on this also. Like individually for each of these symptoms, you'll find a lot of research papers. So I'm not going to go too much into this because that can be a 5-hour talk itself, but this is how you test. Okay, so symptomatically is one thing. But like I said, symptoms can also come from many other places, right? Even a thyroid that's not functioning well can cause energy issues. So how do you know for sure if your omega-3 levels are appropriate or not? Now, this, what I've put on the left is it comes from a slightly more advanced test. We don't have the testing that's done for this in India, like actually looking at your omega-3 index. This is from Quest Laboratories, which is US based. They do a serum omega-3 test that gives you a complete and total breakdown of actually your omega-3 levels. Okay. And in India, there are a few labs, I think, that do blood spot testing, but based on our research and the papers we've read, the most accurate true assessment of your omega-3 status is through serum itself, right? So Quest Diagnostics does these tests, and these are the data points from Quest. We don't necessarily run the Quest Diagnostics test for our, because it's expensive. You have to like take samples, send it abroad. You need your all those FedEx approvals and everything. So what we look at is more of the regular blood work that we can get from any lab in India, right? So we look at WBC. Now, what WBC will do is it will tell us if you have an immune reaction, and then we look at the other neutrophil, lymphocytes, everything else there. But we look at a basic WBC level. If it's out of optimal ranges, then definitely some sort of an infection has triggered a high WBC, and then it would mean that the omega-3s are getting depleted. Highly sensitive CRP. CRP is a marker for inflammation. So is ESR. CRP is something that we use to kind of look at more recent inflammatory assaults. ESR can indicate a long-term inflammation, including autoimmune processes. So both CRP and ESR in combination tell us if like there's severe inflammation going on in the body. presence of inflammation is equal to increased need for omega-3. Definite depletion of omega-3 has happened, especially the diet is not rich. We also look for homocysteine because it's an inflammatory marker, right? So if somebody's homocysteine levels are elevated, for whatever reason, they could have a gene mutation, they could have B12, B6 deficiency, and that's why homocysteine is elevated, or it could be a sleep thing, a lifestyle thing. But if homocysteine levels are high, again, that's indicative of inflammation. The same thing with ferritin, right? So ferritin is how your body actually stores and transports iron. If ferritin levels are high, it's usually because there are inflammatory processes going around in the body. And it's a marker that we use to check inflammation. Vitamin D, again, we've seen that with chronic infections and autoimmune conditions, vitamin D levels drop. If that's happening, again, the body goes into a state of stress, and that's when omega-3 needs are increased. Neutrophil lymphocyte is again to see if there are inflammatory infectious processes going on. Uric acid, again, we use it as a marker of inflammation because it's not always just about gout. Sometimes if you have a lot of oxidative stress, the body makes uric acid to kind of attenuate that oxidative stress and bring that oxidative stress down. So that's a marker we use. And then these, right, your fasting blood sugar, your postprandial blood sugar, HbA1c, serum insulin, postprandial. So all of these are markers that we use to see how is the body doing in terms of its glucose response. So is it producing enough insulin? Is there enough insulin sensitivity, or is there insulin resistance? Typically, if your diet is very high in omega-6 fatty acids, there would be insulin resistance. And when that is happening, it's very obvious that the omega-6 to omega-3 ratio is completely off, right? So every time we see insulin resistance and diabetes, we know for sure omega-3 status is completely off. So that's why we do these tests, right? So while these would be the most accurate way of assessing omega-3 status, we might not always have access to these tests. So this is what we run for our patients, and we've seen huge amounts of correlation between these tests and the status of inflammation. And then we've seen how supplementing with omega-3, bringing in more omega-3 rich foods actually helps with a lot of these parameters. Best sources of omega-3s from food: fish, oysters, extra virgin cod liver oil. Krill oil is phenomenal. Walnuts, different animal brains, and shellfish. Okay, so these are the best source of omega-3s from your diet. I personally, while I eat seafood and while I eat prawns, because I don't eat it every day, I actually take a omega-3 supplement because otherwise I don't get it in my everyday diet. So you saw krill oil here. So krill oil and you know, like 1990s, even until now, like until 3 years ago, mostly fish oil was being recommended for omega-3 supplementation. Even when I started off my practice, I used to recommend fish oil. Of course, the brands were heavily investigated and seen for low mercury. But I used to recommend fish oil, and it's only last year after Suyash came on board that we started looking at other sources because we wanted to avoid the issues that come with fish oil, right? So what are the issues? One is like when we say krill oil is better, what we realize that the EPA and DHA in krill oil, they are much more bioavailable. So the absorption of those is much higher than the one in fish oil. And that is because the EPA, DHA, both in krill oil are bound to phospholipids. And then krill oil also contains an antioxidant called astaxanthin. So it helps with oxidative stress. The biggest problem with fish oil is it can go rancid very quickly. And it can have very high load of mercury, especially if the fish oil has been sourced from these huge fish that come from polluted waters. But with krill, that doesn't happen. And then krill oil also has good amounts of choline, which is important for cell structure and especially brain, right? So choline is so important for your brain cells. And then cod liver oil. So if we looked at one source here, right, extra virgin cod liver oil. So in the past, cod liver oil was done beautifully, but now it's because of its popularity, most commercial cod liver oils are highly processed with heats, and then like vitamin A, D, and all is kind of gone. And then they add synthetic vitamins. So we found that now, instead of recommending fish oil as a supplement, we prefer giving krill oil, right? So what is krill? It's this tiny little shrimp found in the Antarctic waters. And it has got 40% phospholipids and 30% EPA and DHA combined together, and astaxanthin. And these omega-3s are bound to the phospholipids. 60% of our brain by weight contains phospholipids, right? So these phospholipids from krill oil really are very, very important along with the EPA DHA. Again, if you look at this chart here, I know the text is really small, but maybe I can send the email and then send the image in an email separately after this talk. So krill oil contains omega-3 fatty acids that are bound with phospholipids. They have choline, and these do not require bile salts for digestion and absorption. These kind of get absorbed directly into your body, much more bioavailable. And then they are taken up into the red blood cell phospholipids, right? So the absorption is much higher. Just overall, it's a better form of your omega-3s than your fish oil. And then if you look at this chart here, that's showing you really how krill oil and the brain work, right? So you have your neuron cell membrane, like this is a microscopic cross section of your brain. And you have so much phospholipid bound EPA and DHA, which can go into your neuron cell membrane and get absorbed there. So we have stopped completely recommending fish oil and have moved to krill oil because of all of these obvious advantages that krill oil provides. So what is krill oil? Krill oil is an oil derived from this tiny little, very, very cute looking crustacean called krill. So source this fish exclusively from Antarctic. To source fish, right, a lot of processing and harvesting is required. But when you look at krill, they come in bulk numbers, and they contain EPA, DHA, much better forms than fish oil. That is what we saw here. Now, what we did is we started manufacturing our own krill oil because we were just not happy with the stuff that was available in India in terms of fish oil. And for our patients, we do 3-month programs. We really wanted quick results. So we started making our own krill oil, and that's like 750 mg krill oil per serving. It's very high quality. It's loaded with omega-3s, bound to phospholipids, comes with astaxanthin, which is an antioxidant, completely helps eliminate all the inflammation that one might see. And no other additives, nothing. We just have vitamin E there. It prevents this krill oil from going rancid, right? So it adds on to the antioxidant benefit of this. What is the benefit of supplementing with krill oil? It reduces inflammation. It supports heart health. It supports brain health. We saw why for the brain and heart, both omega-3s are important. It supports glucose metabolism because it reverses insulin resistance, and then your glucose uptake starts becoming better. It eliminates free radicals because, again, it's reducing oxidative stress. It supports healthy blood lipids, which is like the fat in your blood is actually much healthier, and supports joint health because it's reducing inflammation. All the pro-inflammatory compounds that are making you pain sensitive are coming down. It also helps a lot of women with PMS symptoms. We've seen immense practical applications of this because we get all sorts of cases, right from autoimmune conditions to really complicated things like transverse myelitis, to people with IBS and gut issues, to people who come to us with rheumatoid arthritis. And I actually wanted to put case studies here, but then I realized I won't have enough time to talk about individual case studies. But we've seen immense benefits, and even our before-after results have shown that the inflammation has dramatically come down when compared to, when they did their blood work with us at the beginning, and then 3 months of our krill oil supplementation, and then it's suddenly dramatically come down. So it works really well. I'm just quickly going to look at the chat and I'm going to see if there are any questions that are there for me to answer. Okay. Suyash is here. Say hi, Suyash. I think he's muted. Dr. Karishma, can you just unmute Suyash? Yeah. Hi. So Suyash heads the supplements vertical at iThrive. So he and I can answer any questions that come around supplementing, especially because he's gone very, very deep into this, deeper than my knowledge. And I'm so glad he joined this session.
Question. There is one question, Mugdha ma'am. By Siddharth Goel. He's writing, from where do the fish, etc., get their omega-3s?
So they consume algae, which is growing in water, right? And then that algae, through their metabolism, gets converted into omega-3s in their body. Like fish have a different metabolism compared to human metabolism. That's why when, like sometimes when somebody has been extremely strictly vegan and they've wanted to not take any animal source-based supplements at all, I had once found this algal oil omega-3 by one brand in Toronto, because they had extracted omega-3 from algae, but it didn't really make too, like, so we always do before after test, right? So we didn't see it impacting the inflammation as dramatically as we've seen it with like pure krill oil. So yes, algae, right? Like, is there any other source that fish get their omega-3s from?
It's mainly through algae. It's mainly through algal oil itself, which is present in algae.
Yeah. And then the larger fish that eat smaller fish will get that compounded omega-3s from them.
Yeah. Yeah, Mugdha, thank you very much for this session and a lot of teaching about the inflammation, how we can diagnose the inflammation without testing an omega-3.
Yeah.
As per my experience, I had seen some Indian companies doing a blood spot test, and they might be helpful because I had seen most patients, they are deficient in omega-3, and we find out the omega-3 in that sense. So my question to you is, what is the dose you recommend for omega-3, particularly EPA, DHA, that's going to calm down the inflammation? So because most patients, they take a smaller dose of omega-3 for 1 or 2 months, and they think they are taking omega-3 and their inflammation should go down. This is not only things, we require high doses of omega-3, that what we are learning in functional medicine. So my question to you is, what are the usual dose you recommend for EPA and DHA, and how long?
I'll let Suyash answer that question because, like I said, he's gone deeper into this than I ever have.
Yes,
sure. So the first thing we need to understand is, like Mugdha also discussed, that how much inflammation that a specific client or the specific patient has, and how much infection is present in the body. Once we know that, then we can suggest the better dosage. But ideally, in general, if you want to bring down inflammation, at least 1000 to 1500 mg of krill oil, or at least mg of any specific oil is needed, which has a good balance of DHA and EPA. Okay, even in that also, what we have to see is at least they are getting 200 to 300 mg of DHA from that. So if you see a lot of fish oils who has only maybe 80 or 100 DHA in, I think, one capsule, so it requires 2 to 3 capsules. So that's how it differentiates in krill oil, right? That we have tried to put it maximum DHA to EPA, so that ideally in 1 to 2 capsules it is sufficed for lot of clients in that respect.
So what is the DHA and EPA content in krill oil that you talk about?
So yeah, the DHA is around 80 mg, and then EPA is around 100 or 120 mg to be precise. Yeah.
Okay. Yeah. So same thing. I prefer high doses of omega-3. Like you said, I prefer into at least 2 grams of omega-3 for at least 3 months before we can bring down the inflammation. And same thing is, we have to also reduce the omega-6, as Mugdha said, because most patients, they are high in omega-6. If we don't bring down the omega-6 lower, then they also having arachidonic acid, and the arachidonic acid is creating inflammation. So in biochemical pathway, arachidonic acid converts to prostaglandin, and then again, most patients, they take a prostaglandin blocker or NSAID or something like that. So in that sense, omega-6 has to be come down, so the diet has to be modified. So not only supplementing omega-3, it's working in all together, like in correcting the diet and rest of factors and infection, all this in that work.
And the thing about the omega-3 thing, like having higher omega-3s, is why they also produce prostaglandins, but they produce the anti-inflammatory ones, right? So they counter all the inflammation that omega-6s have done so far.
Yeah, that's a nice piece of information.
Yeah.
Yeah, anybody in a audience, they want to ask a question, they can raise their hand. And
daily, how much quantity is required? I think Suyash answered that.
Okay,
What is the option for vegetarians? I am. It's really hard for vegetarians to get their omega-3s from vegetarian supplements. It's the unfortunate reality. You can't, right? Like you saw, DHA is only present in animal foods. It's not there in vegetarian. So if you're open to supplementing, and if you don't want to eat fish, if you don't want to eat prawns, crustaceans, that's okay, right? But I really think one should look at what is the best way they can support their body and take care of itself, beyond a little bit of the personal belief systems or the ethical belief systems or the religious belief systems you might have, because in the end, it's about doing what's best for your body. So if you don't want to eat meat and fish and eggs, you need to really take a supplement that's coming from an animal source. So that's why the krill oil supplement becomes so important.
Yes, so I would like to add something over here. If you look at the science for that showed the pathway.
Yeah.
So ALA is essential fatty acid, and that is required. So we cannot make an ALA in the body. And ALA primarily comes from the flax seeds and vegetables, so pumpkin seeds and all the seeds, they contain omega-3. And if you look at the science, then also DHA and EPA are not the essential yet mentioned in science, but they are, I call it, conditionally essential fatty acid. So if you have inflammation, then they are the primary essential. Your body cannot convert the ALA to EPA and DHA. So if you look at genetics, some patient can convert better ALA to EPA and DHA. So ALA also convert to EPA and DHA in the body. But if you are having some kind of genetic variation, then your body really cannot convert this thing. So if you talk about the number, then only 10% or 15% of ALA converts to EPA and DHA. So if you
that also is in ideal circumstances, right? Most people have, yeah.
So if you have chronic condition, or if you have chronic disease or chronic inflammation, their body cannot convert, because the enzymes they require to convert, they are also hacked by the inflammation and infection, and particularly high omega-6, because the enzymes also compete. So omega-6 also compete for these enzymes. So if you have high omega-6, then the enzyme will convert your omega-6 and they work on a arachidonic acid, but they don't convert your EPA or ALA to EPA. So
exactly, it's the same enzymes, it's the same nutrients that are required in the catalysis. So your B6, magnesium, everything is going to get depleted because your body is like having higher levels of omega-6s. So that's why that chart was important in terms of the metabolic pathway. Will krill oil help in any way in diabetics, neuropathy issues? Yes, for sure it will, because it has DHA, which helps with your nervous system and your neuropathic system. Cost, daily dosage, trade name, availability. So you want to know the cost and the daily doses. Daily doses Surya spoke about, the trade name. I think I can just share the link here in the chat. The for the one that I was speaking about, the one that we're making. I'm just sharing.
I'll do, Mugdha. I'll do.
Okay. All right, I posted it, but even Suyash can post that.
So another question is, can we do overdosing of krill oil? And many times, I got the same question about nutrient. So, you are overdosing vitamin D, you're overdosing vitamin B12, what the effect of that? And usually I say to my patient, see, if you are taking, like, for example, let's say your diabetes and you are taking a metformin. See, your diabetes doesn't mean that you are deficient in metformin, right? So whatever the metformin you are taking, 500 or 1,000 or 2,000, you are actually overdosing that things. Regarding nutrient, we have a larger range for toxicity. I have not seen any patient who have a vitamin D level of 150 nanogram per DL and they have toxicity.
Unless they have like this autoimmune gut issues like Crohn's or something, right? We've seen that in a couple of cases. Ulcerative colitis and Crohn's, the entire vitamin D pathway gets super dysregulated. We've seen super high levels there, but that's like a autoimmune, really bad condition where the pathway itself got dysregulated. But otherwise, yes, you're absolutely right. With nutrients, it's very hard to go and like overdose on them. Yeah.
And regarding omega-3, everybody is deficient, so I don't consider that overdosing omega-3. Even what we had seen, you require more than 2 grams to 3 grams of omega-3 if you are dealing with any kind of acute inflammation, something like that.
And that's the thing, right? Like the capsule itself has much smaller, so you have to take You'll have to take a lot to
Yeah.
kind of overdose on it. What other question?
So
I think we
somebody is
answered
asking
most
the
of them.
ratio of omega-3 to omega-6. Yeah, Mugdha, you can answer the question.
Ratio of
Regarding the
omega-3.
ratio.
Yeah, I think I'd put that up also on the slide. You want to take that one also, Suyash?
Like the only like the answer which I know so far is like it needs to be 1:1, right? As
Right.
close as possible, right? Or otherwise it will counterintuit the omega-3 as well. You can add on Mugdha, like if you want.
Dr. Anish, do you have a different perspective on the ratio?
So yeah, basically, if we talk about the omega-6, omega-3 ratio, ideally is to be omega-6 could be the 4 part and 1 part could be the omega-3. That is, normal circumstances. Right now, if somebody having a chronic inflammation, I have seen, most patients having 20:1 ratio. So omega-6 could be the particular arachidonic acid more than 20 parts. If you are dealing as a therapeutic intervention, my goal is to make an 1:1. So if you are dealing with some acute inflammation for 3 months, I know I just put and reducing their omega-6 and I would like to highly increase their omega-6. So my goal for doing a therapeutic intervention as 1:1. And then again, over a maintenance side, they can go to 4:1.
So for me, what I've done as a blanket approach is I assume that everyone is overloaded with omega-6 and I cut it out completely. Right? There's no need at all for it. Let's just load your body up with omega-3. Let's forget about the ratio for a while because we don't need it. There's enough. And you eat one meal outside, you order one meal from Swiggy, you're going to get all your omega-6s for the month from there. So that's why I didn't want to say what my ideal ratio thing is. I wanted to hear the more scientific thing. I have more of a slightly Nazi level approach, and there's no need only for omega-6. The exceptions and the deviations that you have from your ideal diet will kind of account for the omega-6 that have to come into your diet. If anybody's HDL is low, LDL is high, and homocysteine is abnormally high, what is the cause? So, of course, krill oil will work for the lipid dysregulation for sure. And again, insulin resistance could be one reason why the lipids are out of range, right? The HDL and the LDL. Homocysteine has a lot of other root causes also. So if you have the MTHFR gene mutation, that can trigger high homocysteine levels because the enzyme that's required for the breakdown is not available. Even deficiencies of B12, B6, and overall B complex can cause homocysteine levels to go up. Smoking, alcohol, even dehydration at a cellular level can cause homocysteine to go up. But the inflammation that's being triggered as an outcome of all of these processes, that krill oil will help for sure.
Yeah, another thing I would like to add for homocysteine level, because she had mentioned abnormally high homocysteine level.
Yeah.
Sometime, lab do a mistake. Let me explain you about, when you order a homocysteine, particular homocysteine test, because homocysteine has to be tested within 1 or 2 hours from the blood. So if your lab is collecting a sample in the morning and they are processing the sample in the afternoon or evening, you have abnormal high homocysteine because your RBC is producing homocysteine constantly. So this is a problem with only homocysteine level, what I find out. So I usually send a serum to the lab, not the whole blood. So if you are sending a whole blood and if your blood is processed later, then usually I have seen they are abnormally in a false positive homocysteine level is high. And another cause is MTHFR, and you might be having a methylation mutation over there.
We've seen even lab-to-lab difference in homocysteine.
Because of the problem is because they are processing the sample late.
Yeah.
So if they are separating serum immediately, they will have a variation in homocysteine level.
Yeah. All right. I think that's the end of questions. Also, in terms of time, we are coming close to the closing time.
Yes. Thank you very much, Mugdha, for a wonderful
session. Oh, you're
session.
most welcome.
Thank you very much. Everybody have a good night. Take care. Bye-bye.
All right. Bye-bye.
Okay. Thank you.